I am inundated with adolescents and teenagers that are addicted to their phones, who
Hmm.
are not physically isolated, but very socially isolated, and trying to provide care is daunting. I would say that is my big it's actually, yeah, clinical woes rather than business administration. There's been ups and downs with that, right? There's always something. Getting Beyfortus was difficult last year, and my patients didn't really want it. It was nice that people weren't banging down my door when I couldn't even get it, but let's see what else. Staffing was an issue for a hot minute, but I'm really loving my staffing right now. So really, it's providing mental health care, protecting myself because 'cause I've done a bit too much of it and gotten very sad and tired. So having to say
And,
no is sometimes really hard.
Yes.
Um,
and so, what are your resources? Like, I don't know. Like your hospital is big enough that they still take care of kids and inpatient in Northern Virginia. The community hospitals have all abandoned pediatric inpatient and ER. It's only the children's hospitals do it anymore. So if you have a kid that needs an emergent psychological evaluation, is there a psychologist, a psychiatrist in town you can call?
no, I can call somebody in Portland, which is 3.5 to 4 hours north of here. They have a phone line that I can call if I need help, but if they're in crisis, it depends how bad it is. If they're acutely suicidal and trying to kill themselves, I send them to the ER and they'll put them on a hold and put them in a room to keep them safe. If it's a kid who they're not trying to kill themselves, but just saying, "Gosh, I'm having some dark thoughts and I don't know if I can be safe." Sometimes I'll tell the parents, "You have to just exist with your child until this," and here are some red flags to take them to the ER. But in Douglas County, we have really minimal resources. We have minimal people prescribing to children, or not children, but adolescents mostly. We have a few very good therapists, but they're overbooked and underpaid.
Um,
The
and,
therapist thing is a problem even in Long Island. Nobody takes any insurance. And if they do, you can't get an appointment but in 4 months. What are we
mm,
supposed to do with this?
I'm lucky in that because I have such a small community of people, I have some phone numbers that I can call or text and say, "Hey, I've got a kid. I really need help on this one." And sometimes they can squeeze them in, which has been really nice. But
Right.
without those relationships, I wouldn't be able to help my patients as
Right.
much.
and I have another clinical question. At least here, every year, the thought police changes my language, so I'm trying to be careful. Um, but, but the overweight and obese stage 2 and 3 seems to be taking a big part of the clinical time. Like I dread an adolescent female well child exam. It's never just a well child exam. There's always anxiety or depression or
Oh,
something,
yeah.
some relationship problem with the mother. And it's, oh God, that's going to take me 30 minutes. That's not scheduled for 30 minutes. And then the other third of the time, I play an endocrinologist on YouTube. It's the obese patient, the pre-diabetics. We have this clinic that I help. This year they've had 3 type 2 diabetics and 1 type 1. It's an avalanche, it's a tsunami. And even though we have a lot of resources because we're a big metro area, it still takes 4 months and 9 months to see a peds endocrinologist if you don't have type 1, 500 glucose with ketones, you need to be admitted to the hospital. Are you seeing that out in rural and the West Coast too?
Yes.
And
Our wait time to see an endocrinologist is much more, though, and I feel like there's a heavy leaning towards trying to get us to manage it. Type 2
well,
diabetes, definitely, they're not getting seen, and
I think I'm sorry to interrupt you, but I think we have to step up. There's only 1,100 pediatric endocrinologists across the country, and they're all overwhelmed as it is. And it's all the
Mhm.
same problem. It's a problem that Medicaid does not pay enough money for the children to be seen, and 50% of the children are on Medicaid. And if you're not in a procedural based science or career, and you don't have a heavy insured population, then you're treading water.